Sean, thank you very much for joining us today. Can you start by telling us a little bit about your professional background?
I'm the Director of the University of Melbourne's Centre for Cancer Research, and I am a genome biologist really focused in cancer pathology. My background is genetics and pathology, and I guess over the last 10 years I've really pioneered the use of genomics to decode rare genetic disease and cancer.
And why is it important to understand the genome of cancer cells?
We've known for many decades that cancer arises through the accumulation of damage to your DNA. For many of us, and certainly for the solid cancers, we'll find that a lot of that damage is accumulated over your lifetime. In a small percentage of the population, some of that damage you inherit from your family. And I guess what we've seen in the last 10 years is a revolution in this area of genomic technology, which now allows us to decode cancers and understand the full combination of damage that is present in those cancers, and indeed then be able to determine what are the root causes of that tumour, and indeed what might be the things that are driving that cancer and making it grow.
And how do you go about actually unpicking the genetic code of your cancer cell?
It's the ultimate jigsaw puzzle. Really the concept is very simple. We will take some DNA from normal cells, and we will take DNA from your cancer cells. We will shear up that DNA and make a complex jigsaw puzzle. We then go through and sequence those fragments. We will map them back and try to identify what is unique about your genetic blueprint in your normal cells. So each one of us is probably about 3 million differences between you and I, and we will catalogue every one of those. And then we will take your cancer cells, and now we'll look at what damage is unique to your cancer cells. And once we know where that is, we can map it back to which genes then may be perturbed. And then we know that amongst those, some of them will be driving your disease.
So how does looking at the genome of a cancer cell inform treatment for a particular patient?
I guess it can help a patient in several ways. The first one would be it can really assist in the diagnosis of your cancer. So typically we make sense of cancers by looking at the tissue, we use histology, and in many cases that could be quite difficult to be certain. Now DNA can actually give us a lot of insights into where your cancer really has come from and exactly what type you've got. The second one is that we know that in order for your cancer cells to grow, they will need some sort of signal to promote that growth. And if we can identify the signal in your disease, there may well be a drug that can target that. So if we think about BCR-ABL in chronic myeloid leukemia, or the BRAF mutation in melanoma, these are those gain-of-function signals that we can now target with a drug. And if we give that drug to those people, we can have a way of affecting a positive response. The final way is that some people have a defect in a particular process because of that DNA damage. They may be prone to accumulating damage, and indeed that's when we can think about other drugs that we could use to really exploit that vulnerability.
And if a person's cancer recurs, is there an additional role for cancer genomics at that point?
Absolutely. And we've really seen in recent years, once we made sense of what was kicking off your cancer and starting it to grow, we've studied how cancer progresses, and we've seen that the mutation process doesn't stop, it continues, it evolves. And we can select out sets of cells that may have mutations that give them an advantage to surviving a particular therapy. And indeed, we can use these approaches as well to understand what is that mechanism of resistance and can we potentially find a way to get around it.
Now, there have been some suggestions that these developments in cancer genomics might actually restrict choice and access to cancer therapies. What are your thoughts on that?
Look, I think we're at a tipping point right now. We know that when we have standard of care for things like metastatic breast cancer, we know that we've got a particular process as we go forwards. In terms of the costs of those sorts of practices in the clinic now, the amount of money we spend on treating is about the same as the amount of money we spend on adverse side effects. So these drugs can cause serious side effects in patients. There is a promise that this precision approach, or using genomics, may be able to tip that balance where we use drugs only where appropriate. That has a chance of actually improving some outcomes, but it also then means that we may find for some individuals they have a vulnerability, but that drug may be hard to access or may be very, very expensive, and we need to work out the health economics of getting that right.
So we've talked a lot about genomics in targeting therapies. Could you talk a little bit now about the role of genomics in cancer prevention?
Indeed. So right now, when it comes to the use of genomics in standard clinics, when patients present and they would have their tumours studied, we will find that about 10% of those patients have a clear predisposition to cancer. In some cases, that's already known within those families. In others, it's a complete surprise. So we're already seeing the first steps in prevention there, that once we identify those very strong predisposing mutations, we can feed that back to families and family clinics and see if we can start the road to prevention in those families. I think the really exciting area, which we will see come next, is that we will start to understand risk, your risk for a particular cancer type, and then indeed once we can understand that and measure it, bring that into the healthcare system, we have a chance of actually reducing the tumour starting in the first place.
And where do you think GPs fits within all these advances in genomics?
Look, I think given that there is such a revolution right now, you always find that those people in the trenches or at the coalface are the ones that find it toughest. So I think that for GPs right now, they are really probably facing a lot of questions from the public, and as the healthcare system evolves very quickly on this, it makes a bit of a challenge for them. I think that in terms of strong family predisposition and the referral to family genetic services and those sorts of things, I think that path is pretty well established, but understanding risk, understanding how genetics may influence your response to drugs in general, that is really an area that we really need to work on over the years to come.
And what are some of the major ethical issues that you think are raised by these advances?
We have to recognise that the genomics and where we're going now is that I would envisage within the next 3 to 5 years, decoding your genetic blueprint would cost the same as an X-ray. While that is a fantastic tool for us to use within the clinic, there are some big ethical considerations there around that. Here in Australia, we do not have genetic discrimination legislation at this moment in time. And so we, unlike many of the other Western countries, and we need to actually work out how we get that right, that each one of us will have, as I said, 3 million differences between us. We're going to find strengths and weaknesses in every one of our genomes. We need to make sure that patients and people at large are protected from concerns about that information until we really understand it.
Sean, thank you so much for joining us today, and this is really exciting and rapidly moving field.
Thanks so much, John. Cheers.